Hi, my name is Shannel Torres from BSN2A, and today I will be doing a return demonstration about the essential intrapartum and newborn care. So in this video, I will show you on how I will be going to deliver the baby, and also will be showing to you how I will do the newborn care of the baby. So without further ado, let's get started. Good afternoon, ma'am. My name is Shannel Torres, your student nurse for today. And today, ma'am, I will be the one to assist you in delivering your baby. And before we proceed to any procedure, ma'am, I would like to ask if you're comfortable with your position, ma'am, or do you want me to adjust it for you? Ma'am, do you feel any pain or uncomfortableness? Okay. Before we start, do you want to go to the comfort room or do you want to eat first? Okay, ma'am. So, ma'am, currently your progress is 7 cm and is currently dilating. So, later on, when we deliver your baby, I will be there during and after your delivery. Okay, ma'am? Okay, ma'am. So before we start with the delivery, I would like to ask if you are comfortable with your position right now.
Yes.
Okay. So by the way, ma'am, the position that you're currently in is the default position in delivering the baby. That is the semi-upright position. So the first thing that I will be going to do first, ma'am, I would like to give you the privacy that you would need in the delivery. So I would like to close the curtain first. After providing the privacy, we will now check for the airdrops in the delivery room. So we will use this piece of paper, and if the paper directly falls on the ground, it means that there is no airdrop. But if it flows into the direction or not straight to the ground, it means that there is an airdrop. So we need to ensure that all the windows and doors are closed. Remove all the jewelries and perform hand washing. So in order for us to deliver the baby, we will be going to need a kidney basin, medicine tray, califorceps, surgical scissors, pickup scissors, two cord gloves, sterile gloves, dry linens, bonnets, cotton balls, measuring tape, micropore, vitamin K, Hep B vaccines, VCG vaccine, and the eye ointment for the baby. So before anything else, we will be cleaning the perineal area first with an antiseptic solution. So we're just gonna clean the perineal area and we're going to expose it and clean it. Okay, Mrs. Torres, in order for us to deliver your baby, I want you to do the breathing technique. When I say 1, 2, 3, push, you will push. Okay, ma'am? 1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, push. Okay, ma'am? So in order for us to deliver the baby, we will be going to put a clean linen to the patient's abdomen. This is to make, or this is to get ready when the baby is delivered. So now we will deliver the baby. Okay, ma'am, push. 1, 2, 3, push. 1, 2, 3, push. Another one, ma'am. 1, 2, 3, push. Okay, ma'am, last one. 1, 2, 3, push. Baby's out, 7:30 p.m. Congratulations, Mrs. Torres. Okay. Then we will dispose this one. So after the delivery of the baby, now I will be going to inject the mother with the oxytocin. So, Mrs. Torres, I will inject you with an oxytocin po. So, paano na lang po ako? So, after injecting the mother with the oxytocin, I will remove the first pair of my gloves. And then so after removing the gloves, I will put this into a 0.5 chlorine solution in order for it to decontaminate. And I will put it for 10 minutes. After removing the first glove and placing it into a chlorine solution, we will palpate the umbilical cord and see if it's still pulsating. If it's not pulsating anymore, then we're going to grab our clamps and place it 2 centimeter above the base. And we want to milk the cord, and we're going to clamp it 5 centimeter above the base. And we will cut it near the clamp and not midway near the clamp. We will wrap the scissor and place it to the kidney basin. After that, we will wait for the strong uterine contractions and applied controlled core action and counterfraction on the uterus until the placenta is delivered. After that, we're going to massage the uterus of the mother until it is firm, and we're going to assess the mother's vagina for any lacerations and tears. Now we're going to inspect the mother's placenta. So as we can see, the placenta seems to be complete. There is no missing cotyledons and there is no abnormalities. Also, the vagina does not have any lacerations or tears. So now we will be doing the perineal flashing, and we're going to clean the area to avoid any infections, and we're also going to apply a perineal pad or napkin if it's necessary. So now we will check for the patient or the mother's breathing and the baby's skin color and the baby's breathing also. So the baby's breathing, so the baby's color is brown and the mother is okay. So Mrs. Cruz, are you okay now?
Yes.
Okay. So now we will be going to see if the uterus is still contracting. Okay, so the uterus is still fine. And now we will be going to discard and dispose the mother's placenta in a leak-proof bag closed, and we will discard it properly. Then we will remove the second glove and put it in a chlorine solution. Then we're going to advise our client to maintain her skin-to-skin contact with the baby, and the baby must be in prone position, which is in the head turned to be on one side. We will also be going to watch out for feeding cues, which may indicate that the baby might want to be fed. We will watch out for the feeding cues such as mouth opening, lip licking, sucking, bringing hands to mouth, moving head as if looking for nipples, clenching of fists and fingers, bending arms and legs, and fuzziness. After the client identifies those feeding cues, they can hold the baby close to their nipple, nose level, and then wait for the baby to open its mouth and latch on their nipples. After the baby latches on the nipples, we will wait until the full breastfeeding is completed. After successfully breastfeeding the baby, we will now apply eye ointment on the baby's eye. The eye ointment will actually prevent transmissions of any infections such as gonorrhea, which is a known manifestation on the mother to the baby. We will also going to do a thorough physical examination on the newborn, noting for any abnormalities which must be reported right away. And now, we are going to inject vitamin K on the baby. This is to prevent bleeding or decrease bleeding as babies tend to have really low levels of vitamin K. And vitamin K is important for stopping bleeding, so we're going to administer it on the right leg. We're also going to inject hepatitis B vaccine on the baby's left leg, and this is to prevent any transmission of the hepatitis B virus or injection. We're also going to inject the BCG vaccine on the baby's arm, and this will help prevent any serious form of tuberculosis such as meningitis, tuberculosis, or miliary tuberculosis. And we're also going to inject on the baby's arm intradermally. Now, we will inform Mrs. Torres that bathing procedure will be delayed as it is advised that at least 6 hours after the baby's delivery. This will help prevent hypothermia and the baby may feel too cold and the baby's temperature will drop beyond normal levels and it may lead to further complication. Also, delayed bathing period gives you more time to have skin-to-skin contact with the baby. So, after the delivery and the procedure, I will now document all the things that happened in the delivery room before, during, and after. And then I will put it in here and so